You're listening to Big Blend Radio with Nancy and Lisa. We're a mother-daughter team and the publishers of BigBlendMagazines.com. And our next guest is Dr. Annemieke Austin. She's the director of the newly launched allergy department of Gordon Medical Associates up in Santa Rosa, California. And, you know, we've actually had him on the show before. We haven't met Dr. Austin yet, and I think this is even amazing that they have an allergy department. Kind of says something about what's going on in our world with allergies. But they do something really neat, and I think in the medical world now and taking care of our health, this is a really cool thing. They do a free lecture series. They have a free lecture Thursdays where you can go and have seminars and you don't have to pay. They're free. And she's going to be hosting one on the 18th of October coming up, 6:30 p.m. Of course, Santa Rosa, California is where they're based. So that is up in Northern California. You can learn more. Go to GordonMedical.com. But she's going to be giving a lecture on integrative approaches to premenstrual syndrome. So PMS, yes, the PMS word. I'm going to say it's a three-letter word. How are you, Dr. Austin? Welcome to the show.
Hi, I'm good. Thank you for having me on.
Oh, you know, we're excited about this because I know most people aren't. You say PMS, the men run. You know, we were talking with a negotiating expert on the beginning of the show, and I said, well, how are you going to negotiate your way through PMS, you know?
Well, they should be interested because almost 80% of women suffer from some sort of symptoms prior to their period. So, and we're around men, so they should be interested so they can figure out ways to help us.
There's a good one. You know, it's interesting. We've actually chatted with one doctor. Dr. Griffith's been on our show, and she said her husband makes her a steak. She feels it, and she looks at him, and he just goes to the kitchen and makes her a steak. That's what
and that helps her?
Yes.
Okay. That's one of the things that we look at is actually protein and tryptophan. For example, there's studies on tryptophan, which is found, well, not as much in steak, but turkey, and that can also be helpful for PMS. So I don't know. Maybe that's what the mechanism is there for her in her steak.
That's interesting. You know, at the same time, okay, so you've got that. So maybe we'll all be calmer during Thanksgiving.
Yeah.
Well, that's why
true.
everybody falls asleep after they eat.
See, yeah, but Nancy, you know, Nancy's always said she doesn't really believe it happens.
I think two things seem to be blown way out of proportion sometimes. One is I'm pregnant and you have to get up at midnight and go to the store and buy something. I think, you know, because I've been pregnant and I never really had that experience where somebody had to go buy something for me. And then the PMS thing also, I mean, I understand, you get cramps and you feel tired and there's bloating. I get those. But the temperament change, you know, like one day it's like, you know, Dr. Jekyll, Mr. Hyde. Sometimes I just think it's like so blown out of proportion. It's kind of like the TV show with Bridezillas. There's a lot of brides that can handle putting on a wedding. They don't end up on TV as a Bridezilla.
Yeah.
You see what I'm saying? It's like it's kind of an excuse to turn into a bat from hell when you know, I think sometimes women are pushing the envelope there.
Yeah, almost like using it as an excuse or we just expect that we're going to be that way.
Yeah, and I think taking advantage of it, you know, how much is real?
Or how much of it is environmental?
Well, that's hard to say. I mean, that's pretty much what we're looking at. I mean, as a doctor, I'm always looking at environmental causes and what's real and what's not. And it's hard. I don't think anybody ever really knows completely, so that's why you have to look at both. So, but it definitely, I mean, it is medicalized in that, for example, the DSM-4, the psychiatric, you know, where they come up with all the psychiatric diagnoses and all the different symptoms you have to fit the diagnosis. So they made up, or you know, somebody, the association, the psychiatric association, came up with premenstrual dysphoric disorder, PMDD, and really what that is a more severe form of PMS. So now it's basically a disorder.
Oh, wow.
Yeah, and apparently, according to their studies, it affects about 3 to 8% of women within the people who have PMS. And apparently severe PMS is common in about 30% of people. And there's a whole list of symptoms that you have to fit within to have that diagnosis. So if you're interested in hearing those symptoms, you probably know most of them. But the important part, apparently, is that it's cyclical and that it happens before your period. And if the symptoms happen the beginning or right after your period, then it doesn't count as PMS.
Oh. How interesting. Okay, so let's look at this. What really causes it? Because, all I can say is, to me, if you're active and you're drinking water and you're eating correctly, it seems to be non-existent. But as soon as you start to go on the unhealthy zone of life, like if you're picking out on fast food for the last few weeks and over drinking and you're not active, I think, I don't know, this is just my personal thing. All I know is if you do not move, have any kind of movement, you're in trouble.
Yeah. Well, that's true. I mean, there are studies that show that people who don't exercise enough, or women who exercise versus women who don't exercise, you'll have worse PMS if you don't. And it seems kind of obvious, but somehow they had to do a study on it to prove it. And then also decreasing just processed foods, like you said, going out and eating all kinds of junk food will predispose you to developing PMS, probably because of the refined sugars, which can affect your hormone balance. And the other thing, smoking cigarettes increases your risk for PMS. It's a lot of the obvious things. But then there are studies that they look at, twin studies, where some people have PMS despite having different environmental influences, being twins and having the same genetics. They tended to gear more towards having PMS. So it seems like maybe there's a genetic component to it. And one of the other things that I thought was interesting in my reading is that some of the latest research, they've been looking at how the hormones affect the neurotransmitters in your brain, like serotonin or GABA. So I'm sure people have heard of serotonin. It's kind of like the happy transmitter.
Dolphin.
So, and so decreased estrogen or a difference in the way your body responds to hormones can decrease the serotonin or even the way that it's handled in the body. I don't think we completely understand it, but we know that that plays a part. And so that's why a conventional treatment for PMS, or people who are very severely depressed and have severe symptoms of PMS, they'll consider giving an antidepressant. And those have been shown to be effective, although there are many other things that you can try before you go that route.
That's interesting. So when you're talking about integrative medicine, is that kind of what you mean? It's kind of like looking at what's going on with the patient completely, because it seems sometimes when it comes to the relationship between patient and doctor, that sometimes it's almost like a patient needs to learn how to be a patient and speak to the doctor a little bit better. And sometimes, I don't know, there's just this, I think this relationship thing has to be changed up a few notches between all of us. Does that make sense?
Well, one is that I'm lucky enough in my practice that I have enough time to spend with the patient. Where I've worked as in inpatient in the hospital. I've also worked at various clinics, and sometimes when I have 10 to 15 minutes with a patient at a time, it's really difficult to practice a comprehensive or a holistic approach. And that's kind of where a lot of our medicine is headed. Is it's driven by money, and so we have to see patients every 10 minutes, and that just makes it difficult. And now I'm forgetting what the original question was.
No, I was just kind of talking about being integrative. I can't even pronounce it now.
Integrative.
Yeah.
So,
when it comes to that,
integrative is just kind of a term that probably Andrew Weil or one of those doctors came up with to just means looking at more than looking at the symptoms. So looking at underlying causes and the whole body. So that can include many different things. So for PMS, that would include the lifestyle, the diet, the amount of sleep, and I also do a lot of work with hormones, and that includes estrogen, progesterone, testosterone, thyroid, metabolism, even blood sugar problem, handling blood sugar or predisposition to diabetes, even if you don't have diabetes, can also affect your hormones. So that's another thing that I look at.
Wow. Okay. So now, What about stress? With everybody's really kind of stressed and irate these days. It seems like it just seems like that.
What about stress? How does that cause PMS or?
Yeah, can that affect your body to a point of you can actually have a chemical reaction? Do you think?
Yes. So if you have chronic stress, what happens is initially your body goes into a fight or flight response, kind of like when you're, think of back when we were living in a cave and the bear comes and you just you're very scared and you're running away. Well, when you're under chronic stress, that's kind of your body is reacting in that same way, and it's producing hormones to be able to deal with that, to keep your blood sugar regulated, to kind of get your nervous system revved up so you're constantly going. And that over time can be depleted. So, for example, cortisol is a hormone, that's the stress hormone. That over time, if you're constantly stressed, your body is constantly trying to make cortisol, and if it's making cortisol, then it's not able to make some of the other hormones. You can kind of compare that to, let's say, an athlete who over-exercises and then her period stops.
Right.
So it's like a chronic stress on the body, and the body has to stay alive, so you have to make cortisol to stay alive, and it will stop making the other hormones. So it's definitely stress can cause all kinds of hormonal shifts in the body that you probably would not want in order to live a healthy lifestyle.
So, Doctor, do men have cycles like this too? Because I know a lot of men that I think have more PMS than women.
Yeah, well, men do too, and especially men who have blood sugar problems. So about 40% of the population are predisposed to something called insulin resistance, and that basically it's almost like a predisposition to developing diabetes, and insulin can directly disrupt hormones, and it also can decrease testosterone. So sometimes having one thought would be that the blood sugar dysregulation could be contributing to hormonal changes in men as well. And I'm sure they have cycles. I don't know. I haven't specifically researched their cycles, but I'm pretty sure that they do.
Right.
It would seem physiologically, it would make sense that they do develop that. So
and Dr. Austin, the other thing too, when I know that you're now heading up the allergy department, and to me, that you even have an allergy department really does kind of speak to what's happening in the world. Because, 20 years ago did we see things about, being allergic to gluten and all of this? I mean, is this really just getting to the point of we have too many refined sugars and our diet is bad and the environment? What's going on?
Yeah, well, it's hard to say exactly what it is. I mean, I'm sure there's many different theories. I'm sure there's lots of different things that are playing a role, like you said, the toxins in our environment, the things that we breathe, the air that we're breathing, the water that we're drinking. Even the water has toxins in it. Unfortunately, people dump their medications into the garbage, and that ends up into our water supply. And so we're basically all drinking various medications, including many women are on the pill, so hormones. So we're exposed to a lot of different chemicals in the environment that can also disrupt our immune system, and as well as our hormones, and probably predispose us to cancer and different things. So it's hard to stay away from, but there are things that you can do to improve or decrease your exposure to these things.
And when you're being in the allergy department, if you have an allergy to something, okay, this may sound weird, but I'll be right honest with you. When I left this country when I was a baby, pretty much a year and a half old, and I had every allergy in the world: breathing, food, dairy, everything. As soon as I got to Kenya, everything went away in 2 weeks. I had no breathing problems. I could eat things I didn't before, all kinds of stuff.
For example, in this country, she couldn't have dairy products, but in Kenya she could.
Right. So now, when I came back here, even when I lived in England for a while, it started to creep back, go back to Africa. It was going away. But Africa started getting a little processed. Like South Africa, was actually really well known for its cheeses because it's Dutch, and there were really good fine cheeses. But then it started to take the processed route. This is kind of this weird global thing we're going through now. Yeah. And coming back here now, suddenly, like I'll eat something and my tongue starts my eyes will start to droop, and I'll actually feel like I'm falling asleep. My tongue will tingle, and I'm like, what the heck is that? No, and there's just weird things, and you can feel things slide, go up and get weird. And I went vegan to just kind of clean my whole system out. Now I can eat a little bit of dairy, and I can eat a little bit of meat here and there because I stopped eating meat too because I couldn't process meat here. And I don't quite get it all, but at the same time, like if I eat too much meat, I will have a problem with PMS. I will have that kind of reaction because I somehow deep down feel that you could have a PMS problem because of you are doing something that is hurting your body through an allergy or something that is almost, like a sensitivity, because there's a sensitivities, right, too. Besides having an allergy, you could just be food sensitivity.
Yeah. Well, so you eating dairy in another country and being fine in here, and you mentioned the processed part. It could be that maybe there's a preservative or some sort of a chemical that the cheese manufacturer added. And then also thinking about the health of the animal here versus maybe the cheese or milk that you had in Kenya, that the animals here are given hormones at times and lots of antibiotics, and some of those things will be, and pesticides. Actually, the food that they eat, they will concentrate pesticides in the meat and in the fat. So if it's not an organic, healthy meat, I generally tell people to stay away from it because those are also toxic for us as well as hormone disruptors. So that might be contributing to the PMS as well.
See, I was wondering if there was a link between the hormone fluctuations going with food. I'm just talking in general, not now for myself, I really am just like, just go hike and moderation is just and I'm very much that way, like do hormone and all the good people when you eat meat as much as you can, but you travel and there's times when you go, well, that piece of chicken looks like safer than that piece of lettuce over there.
Yeah, you really have to think, you have to decide where you're at and what's safer. But if you do eat meat, though, I generally will recommend, for at least up here, it's easy for us because we have a lot of farms and we can get free-range meat or grass-fed beef. So at least if you eat beef, get the grass-fed beef, the type of beef that actually ate what they're supposed to eat and not force-fed genetically modified corn. You just do the best that you do the best that you can.
Thank you for saying that.
Well, no, and it's true. I don't think people realize how much our senses are attacked. A glass of water, and you might pick up a piece of meat and think, okay, well, it's going to have something in it. It's not good for me, but it's just going to be a little bit.
Yeah.
It's a little bit from a lot of places all the time.
Yeah. That's true. And the other, actually, PMS, I did find a study to show that PMS symptoms improved with people who cut out dairy products. And whether that's because people are sensitive to them or that there may be presence of estrogens in the cow's milk, that might be part of it. But I generally will have people cut out dairy products for a couple months and see if that makes a difference.
Yeah, you know what? It's even, I know we're at the end of the show here, but it's actually interesting because as soon as I change my diet up, I can totally, I can tell 100%, just like hormonally. I don't know, I'm one of these people who can read you kind of feel your body, you try and get as in touch as you can. But there's this, it'll affect everything. One thing will affect all the way to your teeth, It's horrible.
Yeah. Well, your whole body is made of what you actually eat. So anything that you put into your body will become a part of you. Or your body has to try to get rid of it and have to go through the liver. So the less processed food and the less chemicals and the less whatever food you're eating, if it's gone through a factory and it's put in a box and it's processed, those are the things that if you can't read everything on the label and you don't understand what it says, you probably shouldn't put it in your body.
Well, Dr. Austin, thank you. I think you're invaluable to the world with what you're doing on this. I just want to quickly give a shout out to your website, gordonmedical.com. Are you doing these lectures every Thursday? How often do they happen?
Well, I was doing them every month, and now I'm doing them every other month. But I may start doing them more frequently. And really, I'd like to know what people want me to talk about because I'd like to get some feedback on that as well. Because I'm happy to gear my talks towards, what people are most interested in.
Cool. Man, I want to come see you when we come up to Northern California.
Yeah.
When we come up.
That would be fun. You should come by.
Yeah, absolutely. It'd be fun. Now, I want to ask this also real quick. When you do allergy work, do you have to go through that thing where you get zapped on a whole bunch of different things? So it's like, here, if you're allergic to Russian thistle, we're going to give it to you to see if you're allergic?
Well, the allergy testing that we do is, we can do blood testing for some things, but we generally will do skin testing because we also look at something called latent delayed or late reactions, almost like when you go get a TB test and they do that little shot in your skin and then they have you come back a couple days later. We look at two different ways that your immune system reacts. The way that it reacts immediately, like when you start sneezing, you're exposed to a dust mite and you're immediately sneezing, versus something like molds and yeast, which is very common up here in Northern California. That generally will react slower and will show up on the skin in about 2 to 3 days. So we do the skin testing for that, and we can numb up your arm, and it generally is pretty painless.
Wow. I think definitely. We're going to have to connect when we come up your way, because I think this is fascinating, and I hope you come back on the show too, because I think so many people are having issues with allergies and not really understanding, and obviously they need to go see someone, but I think there's, definitely some help, and I think what you're doing with your lecture series is great. Again, everybody, GordonMedical.com. If you're up in Northern California, go check them out. And this lecture that Dr. Austin is doing is October 18th at 6:30 p.m., so go check it out. And you guys are also on Facebook too, right?
Yeah.
Yeah. That's right. I've been following you.
We have a blog as well, and there's various articles that we post on there that can be interesting as well. And I'll put my PMS lecture on the blog.
Oh, and it's going to be linked from your website too.
It'll be linked from the website, yeah.
Okay, great. GordonMedical.com. Thank you so much for joining us.
Thank you. Thank you very much.
Take care.
Okay.
All right.
Bye.
Bye-bye. I want to thank all our guests and listeners for joining us today, and we will be back on Sunday for Champagne Sundays. We've got a lot of good stuff happening. Take care, everybody. Enjoy the rest of your evening.